And describe the parts of the nose that are important.
Well, besides those terms, then we talk about when we're talking about the bridge, there are the nasal bones, for instance. This is the upper part of the nose, and this is the part that you see on a skull, where those little bones are sticking out there. The rest of the nose is cartilage, which is this softer framework, and it's more of a rubbery skeleton. And of course, we know it all returns back to its starting position, sort of like a stiff rubber would. So there is the cartilage that makes up the tip, and then this part of the nose is also cartilage. We call this the mid-third of the nose. And then, of course, there's the upper third, which is the bony part. There are two nasal bones, one on each side of the nose. And then, of course, within the nose, there are the sinuses. Those are the air spaces in the bone that you don't see, but tend to collect infection and may collect with mucus and cause headaches and pressure and those kinds of things.
And Dr. B, why do people need rhinoplasty?
Well, the nose has not only a cosmetic component to it, but a functional component as well. So, of course, some people think their nose is disproportionate to the rest of their face. So if they have a large nose, it may be distracting when people are talking to them, for instance. And often patients, after they've had their nose done, will comment that people now say they have nice eyes. Well, it was because the people they were talking to were uncomfortable telling them what pretty eyes or lips they had because they were so focused on the nose and that individual's nose, and it was kind of distracting to them. So sometimes what plastic surgery is about is just getting the features in balance so that people see the whole face rather than focusing on one area or the other. Likewise, some people have too low of a bridge of the nose, and in which case we're adding something onto the nose. They would have what we consider a saddle nose deformity or simply a weak nose. And so cosmetically they may be trying to get their nose back into a balance situation, or they of course have a large tip, or they have a very large nasal base, and of course they want their nose to be balanced and even within itself. So maybe one part of the nose itself is out of balance with the rest. Some people have had an injury and their nose is crooked, there's fractured, there's depressed bones, whatever. And then there's some people who are having breathing problems. That may be from the deviated septum. Again, that cartilage separating the nose into two passages is very crooked, it's blocking up one side. The tissues may be swollen, and they may, by correcting these problems, improve allergies, sinus headaches. Many people are misdiagnosed as having migraines, and it's been found that if you straighten out their septum and remove areas of contact inside their nose, their migraines may be going away, and they may be treated for years on strong pain medicine for migraines and not need that. And other people have just a lot of mucus drainage, they have pussy drainage, they have snoring, also can be improved by fixing nasal breathing. So nasal surgery, the two are linked together. A nice cosmetic result and a straight nose usually means a straight airway on the inside and good breathing and good nasal respiration.
Dr. B, what procedures are available for rhinoplasty?
Well, again, we're here with nose surgery. We're talking about the inside and the outside. For the outside, there are procedures where we simply straighten the nasal bones, and then there are ones where we adjust the tip and ones where we adjust the base. Patients maybe, if they talk to several doctors, learn the difference between an open and a closed rhinoplasty. Open rhinoplasty is when the doctor makes incisions along the bottom of the nose so that they can pull up the skin and better visualize the structures underneath. Personally, in my experience, I'm so comfortable doing the closed rhinoplasty that I feel that that's routinely unnecessary, and that the open rhinoplasty creates an unnecessary scar and often can impede the circulation to the nose or whatever. So in terms of talking to your doctor, though, you want to think about the bridge and whether you want your bridge raised or elevated, and whether it needs to be broken or just filed. So sometimes if there's bone that needs to be removed, it can just be filed off, but sometimes if you would just do the filing procedure, the remaining shape of the bones would be too wide or unsatisfactory, and the bones need to be fractured back into position or fractured straight. Also, there are some times when there's a defect in the nose and we need to add a little cartilage or something from another place. We need to rebuild the bridge by putting in something like an implant or graft. Also, there is, again, routinely straightening the septum, which is called a septoplasty, straightening that cartilage inside the nose to achieve good breathing, and reducing the turbinate tissue, either by radiofrequency or some other means, to allow for good nasal breathing as well. So those are some of the kind of routine things that are done to the nose.